My topic is testosterone replacement therapy. Testosterone deficiency syndrome is a condition also known as hypogonadism. It's a condition affecting men in which the body doesn't produce enough of the hormone testosterone.
A lot of men ask me, what is testosterone? So, testosterone is our main male hormone. It's responsible for a number of things. It's responsible for your reproductive development as a male. It's made in the testes. It actually impacts a number of functions. So it's our secondary sex characteristics, how we develop as men, your beard, your voice change, things like that. It also plays an important role in your sex drive, your interest in sex, your energy level, um, and there's also this role that it has around your overall health status. So if you have if that hormone is low, you can be at increased risk, for example, developing diabetes or hypertension. There are a number of chronic conditions that are related to that low testosterone. You're even at increased risk of dying. So it's not good just to have a low testosterone. It's something that you want to have checked. And there's a lot of this is probably undetected, just because a lot of men don't come in, and a lot of times physicians don't actually check what's going on with testosterone.
Application in medicine. This is characterized by symptoms with or without signs, as well as a deficiency in testosterone levels. Testosterone. In the adult male, testosterone controls all sexual functions. In addition, it preserves the typical male build and appearance. It is important for physical health and performance, and also has excessive influence on mood and sensation of well-being. It is estimated that low testosterone affects 20% of all men over the age of 60.
Testosterone is an androgen. It's a male hormone. The thing is, it's not just important for men. Women need a certain amount of testosterone also. But generally, there's so much talk about low testosterone these days that is a good question. So many men out there, millions of men, certainly in our country and around the world, have low testosterone these days. Back in 20 years ago, men didn't really have to worry about low testosterone until they were mid-50s or even later. These days, I have lots of men in their 20s in my practice, and certainly the numbers increase through the 30s and 40s. It's an epidemic, really. And the reason is all the chemicals that have been introduced into our environment. Think of all the cleaners, pesticides, food additives, preservatives. The worst, though, are the plastics and vinyls. BPA, for instance, on the receipts that fade in the heat, the ones that are heat sensitive, those have BPAs. When you touch those, you're getting exposed. And you think, well, it's just a little thing, but a little here, a little there, it's having a huge impact. And what about microwaving with plastic or drinking from a plastic bottle that you buy at the convenience store and it's cold in, but somewhere along the way, chances are it's been hot, and that causes estrogens, mild estrogens, to leach into the water. And once they're in there forever. So it's causing low testosterone in men, but it's also in women, it's increasing the risk for breast cancer, and it's causing problems, birth defects really, in baby boys. So it's a real problem. Now, how would you know that you have testosterone problems? That is something we'll go into in more depth at another time, but basically low sex drive, decreased sexual performance, but it's not just about the sex. Men who feel depressed or just have lost their drive and their motivation, feel kind of apathetic basically. Chances are that is low testosterone.
The bras. The improvement in libido and sexual function, bone density, muscle mass, body composition, mood, erythropoiesis, cognition, quality of life, and cardiovascular disease.
Well, a growing number of men, middle-aged and beyond, are turning to a hormone produced in the body to treat issues ranging from weight gain to low sex drive. Several new studies document the effectiveness of testosterone replacement, but some doctors point out questions remain. Dr. Karen Power says the therapy she's used to treat scores of patients has also had a profound effect on her own family. Her husband Oliver had gained weight and was increasingly tired. She says a blood test revealed lowered testosterone levels.
Typically symptoms of low testosterone would be fatigue, low mood, depression, poor sleep, aches and pains.
Dr. Power began treating Oliver with regular injections of testosterone replacement. She says the drug is chemically identical to the hormone that's produced in the body, which can drop off as men age. She says the doses used to bring a patient back up to normal are far different than the doses commonly associated with sports like bodybuilding.
So there are very huge differences between maintaining, doing this as a proactive preventative medicine program and doing it for bodybuilding.
Testosterone replacement has been the focus of several recent studies, one of the latest by Bayer Pharmaceuticals in Germany, which markets a testosterone product, found that middle-aged and older men suffering from obesity lost an average of 35 pounds over 5 years. Researchers believe testosterone replacement boosts the body's ability to build muscle, encouraging exercise.
I probably exercised more, I had more energy to do so, but I lost about 25 pounds in 6 months.
Prescriptions for testosterone replacement have more than doubled in the last 5 years, as have the indications for its use. Patient Ashley Tucker says his symptoms were closer to depression.
It's like dismal. I mean, no energy.
He says the injections helped him return to martial arts training. While testosterone replacement has documented benefits, some doctors are cautious about future downsides that could develop, especially for patients who may stay on the drug for decades. Dr. Paul Turek is a urologist in San Francisco who also prescribes testosterone in specific cases.
The rigorous data that you need to really establish a field, the good hard data, is not in yet.
Ongoing research will likely focus on long-term cancer and heart disease risks, but given the current demand among aging baby boomers, several companies are already offering new testosterone-based drugs, and some analysts have predicted that prescription sales could triple to more than $5 billion a year, putting testosterone replacement in the financial league of Viagra.
Testosterone, I have to say, it's kind of an elixir. If taken in the right way, it improves quality of life. It has a lot of effects on a lot of the body. It's like putting premium fuel in the body.
There are a lot of men now on testosterone for these general health optimization reasons, and one of the most rapidly growing fields of medicine.
The cons. Possible risk includes worsening symptoms and being potassic hypertrophy, increased red cell count, liver toxicity, worsening and threat of sleep apnea, or severe heart failure.
I often get the question, and it's a great question from patients with any therapy and any hormones included. Okay, it looks like I need these hormones. I need to start this therapy. Once I get my levels up, will they stay there? Do I have to stay on this the rest of my life? Or will my levels just stay where they are and I can go off of it? It's a very fair question and a great question. And I often spend quite a bit of time talking to patients about it. The reality is, when we check your initial levels, your labs, and if your levels are low, there are various reasons behind that. There can be many, many reasons. Lifestyle, stress, injuries, previous steroids or anabolic use, many different things, but the end result is ultimately the same, and that is your testosterone level is lower than where it needs to be, and that's why patients are symptomatic. Sex drive goes down, they gain weight, their energy goes down. All of those symptoms come along with it. What we call the metabolic syndrome. you start to put on weight, your body composition changes. More fat, less lean muscle. That leads to elevated cholesterol. It leads to higher blood pressure. It leads to prediabetes and eventually type 2 diabetes. Those are all going into what's being coined now as the metabolic syndrome. That is a huge risk factor for heart disease. And the end culmination of all that is eventually a heart attack or stroke.
To conclude, he can be offered a choice between a renewed attempt at weight reduction and testosterone treatment. If Martin stated that lifestyle efforts will continue, but that his reduction in sexual desire and pleasure is meaningful to him and his spouse, then testosterone replacement therapy can be initiated to show a reduction in symptoms. To address Martin's symptoms, we would recommend daily exercise and reduced calorie intake. If he loses weight, his serum testosterone level might increase. These changes are more likely than a brew of tea to improve his cardiovascular fitness, sense of well-being, and overall sexual function.
Hi, I'm Dr. Karen Power, a specialist in preventative medicine and anti-aging and regenerative medicine. And I'd like to share with you the top things that you should know about testosterone therapy. Number 1, testosterone is not a locker room drug. I use bioidentical testosterone to replace levels that a man has lost over the years. Number 2, testosterone replacement does not cause prostate cancer. In fact, men with the lowest levels of natural testosterone have the highest rates of prostate cancer. Number 3, testosterone therapy can reduce risk factors of cardiovascular disease and also prediabetes, and is therefore an excellent preventative tool.